All right, we have David here today. He's 2 weeks post-op ACL reconstruction. We're going to do some biphasic and MES today because David's been having a little bit of trouble turning his quad on, and he's had a little bit of extensor lag with straight leg raises. So we're going to use some e-stim to stimulate his alpha motor neurons and help get his quads stronger and firing like normal again. He hasn't been having any pain since his surgery. It's been at a 1 out of 10 when he hasn't been doing any exercises, and he's usually about a 5 out of 10 when we're done with therapy. So I think this will be a good way to help strengthen the muscles without tiring him out too much. With any sort of electrical stimulation, there's some contraindications you want to look out for. You want to make sure that your patient doesn't have impaired cognition, that they don't have any implants such as a pacemaker, that they're not pregnant, that they don't have any active cancer, and that they don't have any skin, they don't have a lack of integrity with their skin. So we're gonna check in with David. David, how are you today?
Good. How about you?
I'm good, thank you. Do you have any implants, a pacemaker, anything like that?
Nope.
All right. Do you have any active cancer?
No.
And well, I'll have you raise your shorts up for me a little bit. And it looks like the skin there is good. So what we're gonna do today is in just a second here, I'm gonna put these electrodes on your quad, and we're gonna have the machine help turn on your motor neurons to help you contract your quad so that we can get you stronger and get your quad firing a little bit better. Does that sound okay?
Yeah.
All right. So on the machine, we're gonna go down to 1 minute just for the sake of time, and then we'll hit biphasic and then go back down to 1 minute again. And then we are in channel 1. And then we're gonna keep the pulse rate, how many pulses are coming out of the electrodes, at 50, and we're gonna keep the pulse duration at 200 microseconds because that is the frequency that usually stimulates the alpha motor neurons. We're gonna change the duty cycle to 10 seconds on, 10 seconds off, again just for the sake of time. And then we're gonna turn the ramp up, the ramp speed up, so that it takes a little bit longer for the stim to reach its max, so that it's a little bit more comfortable for the patient. And then for David, we're gonna put this on your quad here, and then we'll put this one on your quad here. And then we want to try to get a solid muscle contraction. We don't want to turn it up so high that you're jumping off the table. It might be a little bit uncomfortable, but what we really want to see is the stimulation from the machine giving us a nice contraction without you having to do anything. And then once we get the treatment going, when you feel the stim turn on, you're gonna squeeze your quad and push down into the towel with the back of your knee. And so you'll squeeze your quad, and the electricity will help you turn on your quad, and then when it's off, you'll just relax.
Okay.
Do you have any questions?
Nope.
All right. So you just let me know when you start to feel it. It should start as a light buzz or tingle.
Okay. Right there.
Okay. And I'm gonna keep going, and I'm gonna watch for a muscle contraction. So we have some little contractions there. And there we have a solid contraction. Higher, lower, good.
You can go higher.
Okay. All right, so we'll stick with it there. I'm gonna go ahead and start it, so I'll have you squeeze. Perfect. and turn that off. And we'll get those electrodes off of you. And it doesn't look like those irritated your skin or anything like that. And so you are all good to go for the day, and we'll see you next time.
Okay.